Good Monday evening. I'm Christy Casciano.
I'm Jeff Kulikowski. Statewide, the three-day averages are down for hospitalizations, ICU admissions, putting people on ventilators. Governor Cuomo says we're now on the backside of the COVID-19 curve.
But two more people, both women with underlying medical conditions, died in Onondaga County in the last 24 hours from the virus. And across the state, 478 people died because of coronavirus on Sunday.
We're joined now by our good friend, Dr. Stephen Thomas from Upstate University Hospital, head of infectious disease there. Dr. Thomas, we love having you in with us to answer some of our questions about this virus. Thank you so much for joining us again.
No, thanks for having me.
So a lot of talk yesterday and today about the governor and this random antibody survey. I know Upstate's not involved in this program right now. Maybe they will be someday. But as an infectious disease specialist, what are your thoughts on this? What do we get out of this?
Yeah, that's a good question. So the first thing people should know is that what they're measuring is the immune response that people have if they are infected. So you get infected, hopefully you recover, and then your body develops an antibody response. And so if you can measure those antibodies, you can identify people who may have been infected. And so it's a really good idea if you have the ability to do it with an antibody test, which a lot of those are coming online now, to do random samples within populations where you know the virus was being transmitted, because it can give you an idea of what I've referred to before as the part of the iceberg that's under the water. So it can give you a better understanding of how many people were actually infected within a population. This can give you an idea of how the virus is actually transmitted and what the infectiousness of the virus actually may be. And then it can also give you an understanding of how effective your physical distancing and other interventions may have been.
The James Street Wegmans, those are the pictures people were looking at up there. The Price Chopper on Erie Boulevard, those are the two spots in our community where they've had this random testing. I want to skip to another question now. From your point, obviously a medical point of view, you know, a lot of people are talking about when do we get restarted? They're starting to see some positive indications, whether you're on the backside or how far we're on the backside, whatever. Medical point of view, how close are we? What's your thoughts on a restart?
Well, my thoughts on a restart are, I mean, I've always been concerned not only about the direct impact that the virus and infection and disease would have on people in terms of, you know, human suffering and death and medical issues, but also on the opportunity cost that the virus and the pandemic has caused. And what I mean by that is, you know, people who needed surgeries, but those surgeries had to be put off. People that needed to see their physicians for some other reason, and those needed to be put off. Our businesses and the economic engine of the region obviously is suffering because of this. So for all those reasons, I do believe that it is appropriate at this point in time to start making plans for how we would be able to, in a very smart and strategic way, start to open up some of those businesses and some of those surgeries and some of those other medical appointments that now have been backlogged. I think the data that you see from New York City, I think that that's pretty clear that they're definitely seeing declines in the number of new cases diagnosed every day. They're seeing declines in the numbers of deaths. When you look at the Onondaga data, I don't believe that the signs of decline are as clear as they are down in New York City. As I've mentioned before on your show, we always seem to lag behind downstate in terms of respiratory virus transmission. It's the same for Western, Central, and Upstate New York. We're behind downstate. And so I'm a little bit more measured right now in my assessment of whether we have reached the peak or whether we're actually on the other side of the peak. Because if you look at you know, just our hospital, we have the same number of COVID patients in the hospital right now as we have the last couple of weeks. And when you look at our curve, again, it's not that exponential growth, which is what we want to avoid, but it is still on the increase. And so it's a good time to start planning and start thinking about it. But at the same time, we still need to be vigilant in the physical distancing and hand hygiene and respiratory hygiene.
Whether it's here, whether it's New York City, I mean, we throw out a lot of numbers, who's tested positive, who's recovered, who's in the hospital. I'm always curious, is there more COVID-19 out there in the community than the numbers actually show? We just can't count it all, can we?
No, you're right. So we can only count what we can count, and we can only count what we actually when we test somebody and we get a test result. As I've mentioned before, again, back to the whole iceberg analogy, and this is not unique to COVID. I mean, this is a common phenomenon you see with many viral diseases. The majority of cases, and we'll define what that is for COVID through these kind of seroprevalence studies that we talked about earlier, the majority of cases go unknown, either because people get infected and they don't have symptoms, or they get infected and the symptoms are so mild that it does not bring you to a healthcare provider, and therefore, you're not tested. So what the ratio is of people who were infected and tested, and that's what we are counting, compared to the people that were infected and not tested, and so they were not counted. We don't know. We don't know what that ratio is right now, but it would just stand to reason because of all the other viral diseases kind of act in the same way, that there are lots of uncounted infections.
Dr. Stephen Thomas, infectious disease specialist from Upstate University Hospital. As always, thanks so much for joining. I'm going to save some of my other questions for the next time we talk to you.
Okay. Thanks a lot.
Thank you.